So my last point before I hand off the slides to our next speaker is if we haven't cured IBD yet, although we're working on it, there's a lot of good work going on, what else have we accomplished? And I never want to speak in front of a patient audience without having you leave feeling empowered that you can control your disease in better ways. We've accomplished quite a bit. In fact, when I was a fellow, it wasn't that long ago, in training, we had practically no treatments for IBD. And now we have many, many that have been approved by the FDA and many more that are coming. I had a long conference call on the way here outlining all the new treatments and where they might be positioned in our future algorithm. So we've learned a few things along the way. We've come to realize that symptom control alone is not sufficient. So we want you to feel better, but it's not enough to do that anymore. It's no longer acceptable just to say, because you're not calling your doctor and you're getting by, it's okay. That's not enough control. We've emphasized now the concept of complete remission, which means not only do we want you to feel better, but we need objective evidence of complete disease control. That means your labs need to be normal. We need to be comfortable that we know exactly what's going on. And one of the examples of that would be to heal your bowel. It would be nice if we could take a look with a scope or use something that is a surrogate for that and know that your bowel is healed, which predicts you're going to do well and you're not going to flare tomorrow. In fact, it tells us you're not going to flare in the next year. We have emerging smart therapies, meaning that we can use treatments now better than ever before. We can know about your body's likelihood to metabolize the therapy properly before we even give you your first dose. And we can know all sorts of things about optimizing your therapy based on drug levels and metabolites from these therapies so that we can truly personalize your therapy and do the best we can before we give up on a treatment and make sure that we're not over-treating you as well. We've learned that prevention is the key to good health. That means making sure you get vaccinated for preventable illnesses. Some of you may be aware that there was a measles outbreak in California that's spreading across the U.S. In Illinois, and actually in Champaign-Urbana, there was a mumps outbreak recently for anyone who's got children there. These things are happening around the U.S., and people on immune suppression may be at risk for getting those infections too. So we need to be careful about that. We've learned a lot more about cancer prevention. People are afraid of cancer, of course, but I want you to know that with the existing strategies we have, we've watched the rate of cancer in colitis drop so low that it's almost the same as the general population. Now, that doesn't mean you shouldn't be getting your colonoscopies, sorry. It does mean that we're doing a good job at preventing them, and that's a great thing. People who are on immune suppression should be seeing dermatologists annually to make sure that nothing is cropping up, and women who are on immune suppression are supposed to have annual pap smears. In addition, regular visits to your IBD doctor. We don't want to take care of crisis care all the time. We don't want you just coming when you're sick. We want to take care of you when you're well, which is when we can do all the fine tuning and educate and talk about how to keep you well. And then lastly, we've developed some customized treatment plans. And in order to do this, you need to be an active member of this. So if you have IBD or someone you love has IBD, can you answer these questions? Where is your disease located? Which parts of your bowel are involved? Do you know? What is your prognosis? In other words, what's the likelihood your disease, based on a variety of factors like how old you were when you were diagnosed and where it's located, is going to give you a problem in the next 5 years? Does your IBD have a pattern that we should know about? Does it flare just in the winter or just in the spring or just when your mother-in-law visits? Whatever it is, you need to know what your disease pattern is and try to think about how you can customize your treatment. And what do you do when you have the earliest sign of relapse? Do you have to wait until you feel sick enough and it didn't go away even though you wished it would, and then you finally call your doctor and then the nurse calls you back the next day and then they say, well, maybe we should do steroids or maybe you should bring in another stool sample? Gosh, you've all been down that cycle. We're trying to break that cycle. We want our patients to be empowered to do something early, and there are all sorts of at-home tests that are being developed now where you might be able to monitor and say, you know, I still feel fine, but this particular test tells me that I'm likely to flare in the next month. So I probably should take that medicine that I was pretending to take that I wasn't taking, or whatever it might be. And then we can do that and preemptively adjust therapy so that we're not under-treating people and we're not over-treating people. And this is what we're doing now in the field. There's been a dramatic change in how we manage IBD. So I want you to know tonight about diet. I want you to know about what we're doing to try and find cures. But in the meantime, I want to make sure that everybody who has these conditions is getting treated the best way they can and that they're taking control of their disease and working with a team that they can trust to help them. So the future of treating IBD is going to include cures for some patients, and we are going to get there. I promise you that. I really do. The second is now treating to get those objective measures of disease control in addition to making sure people are feeling well. The third is monitoring patients over time to make sure we stay on top of their disease and keep them under control. And lastly will be this whole concept of adjusting your therapy before you ever feel like you need it so that you won't need it and you can stay well.